Hello, everyone. Welcome to our LAMP webinars featuring basic TCM and acupuncture. Let's start with our first presentation. Please welcome Ma'am Mildred Digma, certified acupuncturist from Apayao. Good afternoon.
Hello po muli. So pagpapatuloy po natin ang ating pag-aaral tungkol po sa blood. So let's see po. Purple tongue. In general, it takes a relative long time for a tongue to become purple, and therefore, a purple tongue usually indicates a chronic condition. Yun po yung tongue natin, hindi po agad nagbabago ang kulay niyan. So pag matagal talaga yung sakit natin, magre-reflect na po yun sa ating tongue. Kaya napakaganda pong gamitin talaga ng tongue. The only two exemption to this are trauma and surgery. Siyempre, kung may trauma po, nagbabago talaga ba? Nagkaroon ng problema sa nagka-aksidente sa may mukha, pwedeng magbago yung tongue kung naapektuhan, tsaka may surgery. After which the tongue becomes purple in a matter of days or hours. The purple color is not always obvious, as it is often quiet subtle. As a rule of thumb, if a tongue is not of a normal color, not pale nor red, the chances are that it might be subtly purple. It is important to be able to recognize a purple color because it is clinically very significant. Kasi pag purple color po talaga, yan po ay isang sign ng medyo ang disease matagal na. A purple color always indicates blood stasis. Medyo delikado na po kasi blood stasis, which potentially causes serious disease. Example, coronary heart disease, cancer, stroke. So, tongue diagnosis allows us not only to diagnose pathology, but also to assess degree of severity of such pathology. Yun. So, yun po yung purple tongue. Pag nakakakita po natin, pag nakita natin to sa pasyente, ako pang una kong ginagawa, tinatanong ko kung pumunta na sa doktor. Kasi kung hindi pa, una ko pong ginagawa, nire-refer ko muna sa doktor. So, kailangan muna ng doktor po kasi baka may mga matindi ng kalagayan So, tayong acupuncturista, hindi po tayong pang first aid doon. So, in the case of purple tongue, it allows us not only to diagnose blood stasis, but also to ascertain its degree of severity. Yung naging pasyente ko po noon, nung tinignan ko yung tongue, very purple, ang una kong sinabi, pumunta ka sa ospital. Dali pumunta ka sa ospital. Pagdating ko sa ospital, malapit na po siyang ma-stroke. So, nabigyan po agad ng doktor ng gamot para, syempre, hindi matuloy yung mga blood stasis na kasi puputok. Then after po noon, yung clearance ng doktor, saka po in acupuncture. Ito. Yan. So makita po natin yung picture, very slightly purple. Ayan po more on the left side. Kaya pag tumitingin po tayo, pinipatingnan na left and right side. Ito po severely purple, more on the right side. Ayan, makita po ninyo yun, no? So sign of blood stasis. So there are two pathological purple colors. Ito po, bluish purple and reddish purple. Ito po yung yung bluish purple. So the former indicating blood stasis associated with cold. Pag bluish pa, sa cold po yun. And or yang deficiency. Kulang ng init, yang deficiency. And the later associated with heart. Therefore, the bluish purple tongue develops from a pale tongue. So while the reddish purple tongue, ito po reddish purple tongue, develops from a red tongue. So makikita po yung differentiation na Purple tongue, sign of blood stasis. Pero makikita natin kung from cold ba to or heat. So pag yung deficiency, cold, pale tongue, cold congeals blood due to cold. Nagko-congeals po yung blood, kaya nagkakaroon ng blood stasis. Pag naman po, nag-purple dahil sa heat, yung red tongue, heat condenses blood, kaya siya nagkaka-blood stasis. So yun po. Reddish purple pag sa heat, and bluish purple pag from cold. O, alam na natin po i-differentiate ha. Red is from heat and bluish is from cold. Yun ang causes ng blood stasis. Kaya alam natin kung imomoksa natin. Severely bluish purple, more so on the left side. Ito naman pong picture. Sa left side po yung bluish. This patient had a large myoma. So kanina, ano po yung sabi natin ng bluish purple? Ang nagiging cause of stasis is cold. So pwede po natin itong imoksa para matanggal po yung causes ng stagnation o congealing of the blood. So imoksa po natin para i-dispel niya yung cold para maka-flow ng maayos yung blood sa mga channels. Purple chest sa breast area naman po. Ayan, makikita natin kung nasa breast area. As explained earlier, the chest area on the tongue reflects Western pathology of the heart or lungs, or the breast in women. When the chest area reflects pathologies of the heart or lungs, this will be very obvious from the symptoms. Example, coronary heart disease, chronic obstructive pulmonary disease. In women, the chest area may reflect a pathology of the breast, especially when the purple color is unilateral. So ayan po, pag unilateral po, yung kanina, makikita natin kabilaan pag unilateral Ayan po, kikita natin. So, in a women, a purple color in breast area often appears in breast cancer. So, yung may mga breast cancer, dun po yung nakikita natin, purple color. So, and this usually occurs against the background of blood stasis. There is correlation between the purple color of the breast area and the prognosis. The darker this area, the worse the prognosis. So, ibig sabihin, pag mas malala po yung kulay ng pagka-purple, mas matindi na po yung sakit. If the breast area on the tongue is purple in women who have not been diagnosed with breast cancer, this sign may indicate a tendency towards the disease before any symptoms. Wala pa siyang nararamdaman pero nakikita na ninyo yung mga purple color sa breast area. Ayan po sa mga gilid, kabila na dulo. Pwede na ninyong masabihan yung pasyente, punta kayo sa doktor para pumacheck na yung kalagayan ng breast. Then, pag na-clearance na po ng doktor, pwede natin i-acupuncture. Kung may clearance na po sa doktor. So, this sign may indicate a tendency towards the disease before any symptoms manifest. And for this reason, observation of the chest area in the women particularly relevant. So, bluish purple, chest area, breast area. Ayan po So, tandaan po natin yung after ng heart, yung dalawang gilid na yan. Yung gilid. Ito po. Purple filled chest breast area. Either po dyan sa kabilaan. Reddish purple chest breast area. So, ulit po pag bluish due to cold. Pag due to heat is reddish. Ayun po. So, may idea na tayo sa tongue. Okay, thank you po for your attention.
Thank you very much, Ma'am Mildred. Up next is Ma'am Teresita Sumilev of Rizal. She will talk about emotional pathogenic factors. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Emotional pathogenic factors, day 4 na po tayo. Now we will talk about fear. Fear attacks the kidneys. We have often heard the phrases, wet their pants and fear, or get jelly legs when one is afraid. These refer to the bladder and the legs, both of the kidney and the urinary bladder. But it is possible that fear or anxiety could cause tachycardia or diarrhea. This is because even though fear affects the kidneys, it could also affect other organs in the body if they are deficient in some way. For example, fear may cause frequent and urgent stools, such as if the large intestine was already yin deficient, so that the yang flowing in from kidney and urinary bladder could easily cause a yang hyperactivity in the large intestine. Similarly, a person with heart yin deficient constitution may get tachycardia from fear, but the kidneys remain the point of attack, and therefore, where the energy is consumed by this pathogenic fear factor. Okay? Fear can make us behave in different ways, depending on the situation and our constitutional type. If one is attacked by many people, it would be futile to fight back. Or it could be that a physically passive person is not naturally able to defend himself or herself physically. The fear experienced in this situation is a passive fear. One remains passive and helpless while suffering the attack, and it would further consume the kidney and urinary bladder yang. If the situation is too fearful, this could consume the kidney yang overnight and cause graying of hair, incontinence, night urination, and affect the reproductive functions. One of the kidney and urinary bladder yang is consumed, the person will become fearful about the most ordinary things in life. And this fear would make them more passive, which means that they are unable to do anything against the fear and they just let it restrict their lives. They will do less and less in life because the fear makes them more and more passive. As treatment, the kidney and urinary bladder yang should be tonified. If any other organs manifest symptoms, they ought to be treated accordingly. It would be also good if the object or situation of the fear would consider it in the therapy.
Okay, unmute po.
Example of passive fear. A patient has fear of flying and has not taken a flight for the last 6 years, even though she was an active traveler in the past. She has sought treatment from many different therapists and likes talking about her feelings, but will not book a flight. When talking about it, she breaks into a cold sweat and turns pale and is close to fainting. She actually has a mental block and cannot visualize herself inside a flying aircraft. This fear is affecting her life as she would like to see other countries and places, but her traveling is now limited to within her own country. So treatment, this is clearly a passive or a paralyzing fear, which means that the patient is becoming less active or chi deficient in the kidneys. The cold sweating, turning pale, nearly fainting also signify heart, blood, and chi deficiency. Fear of flying is often a problem associated with a need for protection around oneself, like the skin, for instance. These patients prefer to be on the earth and within 4 thick walls, not in the sky with the end nowhere inside. This is a lung chi deficiency symptom. So kidney chi, blood and heart chi, and lung chi is the effect of passive fear. Okay? Now, points against the fear, kidney 3, UB67, and UB23 can tonify kidney yang. Points against the physical discomfort, use REN 14, UB15, UB17, and P6 will help with the heart, blood, and chi deficiency. Points against the object of the fear, use lung 10, UB13, and LI11 to tonify lung chi. Active fear, however, is different to the above. It does not prevent one from attempting any activities, but it makes the person very tense and consumes much of their kidney yin and liver blood. The person is exhausted after these fear-causing activities, be it a confrontation or fight, or a session of bungee jumping, or an interview or examination, and needs a few days to recover from it. A prolonged period with this kind of emotional state could seriously consume kidney yin and cause the burnout syndrome, which may lead to a depression or heart-yang hyperactivity. So it is illustrated here that kidney yin deficiency and uncontrolled by hyperactive heart-yang, because kidney deficient yin can no longer control the hyperactivity of the heart-yang. So continue po siyang nag-i-increase. Okay? Points to 25 kidney yin is kidney 7, REN 3, MOP point UB, spleen 6. Points against hyperactive heart yang is heart 5, loop connecting point, and REN 14. Points for calming is DO 20 and liver 3. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. We now proceed to Shen, or mind. Let's welcome Ma'am Lynn Galarita of Marikina. Good afternoon, Ma'am Lynn. Ma'am Lynn, yeah. Paki-unmute po. Yeah.
Okay po. Good afternoon, everyone.
Afternoon.
Okay, we're on our second part in our discussion of Shen. Today we'll discuss on the functions of Shen. Number one is consciousness. It is the totality of thoughts and perceptions. It is the most important of mind's characteristics. Mind residing in heart makes us conscious as human beings, gives each of us a sense of being an individual. In psychological terms, we may compare mind or Shen with ego or consciousness. Mind being responsible for recognition of thoughts, perceptions, and feelings. When mind is clear, we are conscious. If mind is obfuscated or suddenly depleted, we lose consciousness. Thinking depends on mind. If mind is strong, thinking will be clear. If mind is weak or disturbed, thinking will be slow and dull. Chinese character for thought, to think, and pensiveness all have character for heart as their radical. Another function of Shen is memory. Memory indicates the capacity of memorizing data when one is studying or working, and the ability to remember past events. Both of these depend on mind and therefore the heart, and also on spleen and kidneys. Next up on the functions of Shen is insight. Insight is the capacity for self-knowledge and self-recognition. We are subjected to many emotional stimuli, perceptions, feelings, and sensations. All of these are perceived and recognized by the mind. Insight is lost when mind is obstructed by phlegm, which is a serious medical illness, like psychosis. Another function of mind is cognition, which involves higher mental processes, memory, language, problem solving, abstract thinking. Next on the functions of mind is sleep. Sleep is dependent on state of mind. If mind is calm and balanced, person sleeps well. If mind is restless, person sleeps badly. Another function of mind is intelligence. So intelligence depends on heart and mind. A strong heart and mind will make a person intelligent and bright. Weak heart and mind will render a person slow and dull. Essence, and therefore heredity, plays a role in determining person's intelligence. Another function of mind is wisdom. Wisdom derives from the strong heart and healthy mind. As mind is responsible for knowing and perceiving, it also gives us sagacity to apply this knowledge critically and wisely. Mind also involves in our formation of ideas. It's also another function of mind. Heart and mind are responsible for our ideas, our projects, dreams that give our lives purpose. Ethereal soul also plays an important role in this area. The next function is affections. Our affections depend on mind, as only the mind in the heart can feel them. Affections indicate normal range of affective feelings which all human beings experience. Emotions are affections that, due to being intense and prolonged, become causes of disease. Only the mind actually recognizes and feels them. That's all for today. Thank you very much for listening.
Thank you very much, Ma'am Lynn. Up next is the 5 elements. Let's welcome once again Ma'am Mildred Digma. Good afternoon, Ma'am Mildred. Ulit.
Good afternoon po ulit. So our next topic is about disease of the fire elements. So, stomatitis. Stomatitis po, sores and ulcers on tongue and mouth. Yan, yung minsan masakit po yan. So, treatment, local points po ay REN 23, 24, and stomach 4. We should ensure that there are no scars blocking the REN meridian. So, check po muna natin kung walang mga operation sa REN meridian. So, the yin cannot rise to the face kung mayroon pong scar. Hindi makakaakyat yung energy. So, this scar should be unblocked by placing 2 needles. Kailangan muna nating mag-scar therapy. 1 above and 1 below. Lagyan po ninyo dun sa dulo ng mga scar. On the REN and both kidney meridian. So, yung points po natin gagamitin, distal points po ay large intestine 4 and stomach 44. Symptomatic points or ASHI points po yan na spleen 10. Then, energy balancing point. Ito po, sa ating table. So, these local points are used in order to bring the yin from below to the mouth. So, yan po yung ating drawing. Pag ang heart fire, tumataas po yung yang, the heart fire state is often due to constant excitement. So kung may lagi po kayong na-excite, pwede pong tumaas yung yang ng heart. Magkakaroon tayo ng hindi tayo makatulog. Not sleeping at night, but in the day. Ganon din po yung hindi ka natutulog sa gabi, sa umaga ka natutulog. States tulad po ng mga stage actors and performers suffer from this state. Kasi nga yung mga taping nila, karaniwan magdamag. So sa umaga sila matutulog. Ganyan po ang mangyayari sa heart nila, tumatas ang yang. Then yung stomach naman po, stomach heat state could be as a result of strong flavored foods. Yan yung mahihilig po sa maanghang, mga sili. Pwede pong ganyan na mangyari. Or retention of food because of eating too late in the evenings. Kumakain ka gabi na, mga after 9. It could be also due to being hungry for too long. Masyado kang nagpakagutom. Yan. Pwede pong ganyan na mangyari sa yang ng ating stomach, tataas siya. Then yung yin is mababa. So ang treatment po natin, pag may heart fire, ang gagamitin ay heart 5, small intestine 4. Sedation po yan. Sedate natin. Then REN 14 and do 20. Urinary bladder 62. So, hindi po pwedeng uminom ng kape at manigarilyo. At kailangan pong kayo ay natutulog, lalo na sa gabi. Kasi kahit po yung acupuncture, kung tuloy pa rin ang pag-inom nyo ng coffee, tuloy pa rin paninigarilyo at walang tulog, nagtanggal ka pero babalik po yan. Then, dito naman po sa stomach fire, stomach heat, stomach 44 po, sedation din po yan, kasama ang pericardium 6. Then, REN 12, liver 3, spleen 6. So, avoid po yung mga acidic food. Alam natin yung mga acidic food paano, syempre kasama na rin dyan yung soft drinks. No strong flavored food. Iwas-iwas muna sa lahat ng maaanghang. Yan po. So, if symptoms are acute, pwede pong 2 to 3 sessions lang sa isang linggo. When chronic, 1 session sa isang linggo po. So, kailangan pong 6 to 8 session ang total ng ating panggagamot. Pag Crohn disease po, though this is a young dominant disease, the chi, the function of the small intestine, is affected from the time it becomes a subacute illness. So therefore, points to improve function, the Bakshu points po yung gagamitin, should be given. The heat can be continuously removed by a bleeding cup or Bakshu, or by applying heat elimination needle technique, or any relevant points. So yung points pa is stomach 39 at the lower C point of small intestine is used throughout the treatment with the sedation technique if the symptoms are acute, and the neutral technique. Kung acute po, neutral technique, pero kung matagal na po siya, sedation, when there are no symptoms. So neutral technique when there are no symptoms. So yung treatment po ay local points po, tusukan natin ng REN 4, stomach 25, urinary bladder 27. Distal point, stomach 36 and 39. So symptomatic point, stomach 25 and 27. So yan po yung nangyayari sa small intestine if there is yang excess. Acute small intestine. Pag acute po, nasa normal level yung yin. Then ang nag-excess pa ay yung yang. Yun po yung acute. Pag sa acute, ibig sabihin medyo matagal na, yung yin ay wala na sa normal level, then yung yang lumampas sa normal level. So yin pa ang tawag dyan ay yin deficiency, kasi napakababa na nung yin, nasa below normal, then yang yun naman ay sumobra dun sa level. Then yin and yang deficiency, yan pareho na po silang hindi nakarating dun sa normal level. So yan ang chronic small intestine. So pag acute small intestine, ito po yung mga points natin. Stomach 36, sedation po yan. Urinary bladder 27, bleeding cup. Yung tinuro po sa atin na pwede tayong mag-bleed. Stomach 8, sedation. So bawal po ang coffee and alcohol. So pag subacute small intestine po, yung excess, small intestine 2, kidney 7. Heart 5, stomach 39. So, ang pagkain po is small meals, overcooked, simple, easy to digest. Kailangan po madaling matunaw, magiling. Ito naman po sa small intestine, yin and yang deficiency, kailangan po natin magmoksa sa REN 8. Stomach 39, heart 9, small intestine 3. So, kailangan po natin i-blend yung mga food para madaling matunaw. No whole meal, oily foods, or uncooked vegetable kasi mahirapan po magtunaw yung natin bituka. Kaya kailangan mga naka-blend or na-blender, nadurog. Treatment should be started when medication is gradually withdrawn. So if the patient is on steroid. So kung pagkatapos na muna niyang uminom ng mga reseta ng doktor. In addition, the patient should eat a simple and easy to digest diet. Yung nga po kailangan mga nadurog. This will account for 50% of the success of the treatment. This is mostly overcooked, refined carbohydrates, and roots vegetable in a small portion, about 5 to 6 times daily. So 5 to 6 times po yung pagkain. Konti-konti. Kasi nga mahina yung panggiling niya, dapat papakain natin yung mga durog para ma-absorb. Food must be warm. Oils in meat, beans, and dairy food must be avoided at the beginning. Huwag po natin pakainin nun kasi nga mahihirapan eh. Yung meat, mahirap po yan gilingin. Yun. After 2 weeks, white flaky fish can be included. After 1 month, boiled chicken or turkey. Siyempre, yung lutong-luto po yan para talagang malambot. Boiled cauliflower and broccoli can be added. Kaya lang minsan itong mga foods natin to maraming pesticides. So, kailangan pong linisin natin maayos. Yan, yung iba po binababad nila sa salt para mawala yung mga pesticides at talagang hugasan po ng mabuti. At the end of 2 months, the food eaten can be similar to a normal diet with no fried foods or fatty milk and cheese. So, yun. Avoid pa rin po yung mga fried with no foods or fatty milk and cheese. Uncooked foods, hindi rin pwede. So, including salad must be avoided. Kasi magtatrabaho ng maigi yung yung mga intestine natin. Pag merong mga sariwa, unrefined grains, spices, and bread must be avoided for a year. Kasi alam naman natin na kung bawal, pagalingin muna natin yung intestine. So mga malalambot, mga blend muna yung kakainin po para gumaling. Thank you po for your attention.
Thank you very much, Ma'am Mildred. We now proceed to TCM causes of disease. And let's call on Ma'am Teresita Sumile once again for the presentation. Good afternoon po ulit, Ma'am Teresita.
Good afternoon, Doc. Good afternoon, everyone. Another causes of pernicious influences is dryness. It is internal and external. Landscape and patterns look dry. It manifests in dry skin, hair, stools, cough, and others. Often related to other problems like heat, external pernicious influence, deficiency of blood, and deficiency of fluids. Another cause is summer heat. PI that occurs when exposed to extreme heat. Symptoms include high fever, heavy sweating, and exhaustion. Another cause is the emotions. The emotions worry, anger, fear, pride, elation, sadness, and grief can cause illness, imbalance, disease. It might be physical and non-physical. Always considered to affect the internal. Circular cause affect logic, not linear, and all emotions are part of a healthy or balanced landscape. Of concern only when they are excessive, long-lasting, habitual, or inappropriate. All have a specific effect on the chi and long-term effects on the yin-yang balance of the body. People get sick because they don't have enough love in their lives. Okay? Now, the 7 emotions like worry affects the spleen, which causes stagnation of chi, can cause resulting to dampness. Anger affects the liver, causes chi to rise, resulting to yang rising. Elation or joy affects the heart, causes chi to scatter, and can injure the blood. Sadness and grief affects the lungs, causes chi to be consumed, injuring the chi. Fear and fright affects the kidneys, makes chi descend, causing essence deficiency or depletes the essence. All can cause internal heat. All will eventually affect the heart, especially connection to the 5 spirits and virtues. Another cause is lifestyle. Includes inherited constitution, culturally defined, not to be confused with moral values. Practitioner must be careful not to impose own biases. Changes in lifestyle are difficult and long processes and must be initiated and embraced by the individual. Best guard is to know your own prejudices. Next is diet. Considered important influence on health in TCM. Why? A balanced diet includes all the flavors, sour, bitter, sweet, and salty. So our diet must be regular, then eat for the seasons and environment. Halimbawa, kung during cold seasons, kailangan tayong kakain ng warm and spicy foods and vice versa. And then time of the day. So we must have to eat our breakfast between 7 to 9 because on that hour, our stomach is active. So that is the best time for eating breakfast. And then avoid eating dinner after 7 because that time is when the stomach is less active. So hindi na po niya ma-digest fully ang foods that we take during that night. Okay? Then over or under eating. Then quality of food. You must have to choose nutritious food. And then eat for your pattern. If our pattern is cold, then you must eat warm and spicy foods. Kung warm naman ang pattern natin, so we must have to eat cold foods. Okay, yan lang po. Thank you so much for listening.
Thank you very much, Mang Teresita. We now proceed to the Zangfu organs. Let's welcome, once again, Ma'am Lynn Galarita.
Good afternoon ulit.
Good afternoon.
So let's continue our discussion on liver. So second part na po tayo ng discussion sa liver. Previously, we started with the liver pathologies. So for today, we'll continue our discussions on a different liver pathologies. So let's start off with liver qi stagnation. Liver qi stagnation, stagnation in liver and liver channel resulting from impairment of liver's function of free coursing. Here we have the diagram of the liver, the different parts, the right and the left lobe, the ligaments, and where the gallbladder is located, and in our body, where the liver is located relative to the other internal organs. The cardinal symptoms of liver qi stagnation are as follows: feeling of distension and pain in hypochondrium, excessive eating due to frustration or stress, irritability, moodiness, emotional tension, PMS, depression with frustration, premenstrual irritability, a wiry pulse, plump pit feeling in the throat, yung parang may nakabara sa lalamunan. If liver qi stagnation attacks the stomach, it will present with nausea, vomiting, sour regurgitation, and belching. Next on the liver pathologies is liver blood stagnation. In liver blood stagnation, the free flow of liver blood is impaired. This is a consequence of qi deficiency or of qi stagnation. As shown in the picture, the liver part in the tongue shows a purplish color, indicating stagnation. And among the cardinal symptoms of liver blood stagnation are feeling of oppression in abdomen, dysmenorrhea, dark clotted menstrual blood, stabbing, local fixed pain in the hypochondrium, and distended sublinguals. So katulad ng ibang blood stagnation patterns, yung stabbing and local or fixed pain ang meron din sa liver blood stagnation. Shown in the pictures are different sublingual veins in different severity. Next pathology is liver wind. Liver wind arises from extreme yin-yang and qi blood imbalance. Hyperactive liver yang, liver blood deficiency, or heat may all steer liver wind. Cardinal symptoms of liver wind include trembling, spasms, aversion to wind, sudden vertigo, deviation of tongue. Usually nakikita natin to sa mga na-stroke na mga pasyente. Next pathology is hyperactive liver yang. In hyperactive liver yang, this is a deficient heat pattern arising from liver blood deficiency or liver yin deficiency. As we can see in the picture, red ang mga tongue, walang coating, indicating yin deficiency. Yung isa meron pang crack. Hyperactive liver yang cardinal symptoms are they usually appear in conjunction with symptoms of liver blood deficiency or liver yin deficiency. Presence of deficiency signs is the main characteristic to differentiate between liver fire and hyperactive liver yang since they share the same cardinal symptoms. So magkapareho halos yung symptoms ng liver yang, the hyperactive liver yang and liver fire. Ang hyperactive liver yang lang merong deficiency symptoms since it arises from liver yin deficiency or liver blood deficiency. So the following are the cardinal symptoms of hyperactive liver yang: irritability, severe vertigo, tinnitus with high frequency tone, throbbing headache, migraine, conjunctivitis, redness of the eyes, red tongue edges. Next on the pathology is liver fire. Liver fire is an excess heat pattern originating from liver qi stagnation. The cardinal symptoms of liver qi stagnation appear in conjunction with symptoms of liver fire. Presence of liver qi stagnation is the main characteristic to differentiate between liver fire and hyperactive liver yang, since they share the same cardinal symptoms. Cardinal symptoms include irritability, severe vertigo, tinnitus with high frequency tone, throbbing headache, migraine, conjunctivitis, redness of the eyes, and red tongue edges. That's all for today. Thank you for listening.
Thank you very much, Ma'am Lynn. Up next is meridian theory. We shall continue discussing the heart channel of Han Shao Yin. Now let's go to observation of areas that are related to the Shao Yin heart channel. So if you have redness at the inner canthus or irritated eyes, this may indicate wind or fire in the heart channel. Swollen and deep red vessels under the tongue may also indicate heat toxin in the heart channel. Raised red papules in the area around thoracic vertebra 5 or the fifth thoracic vertebra, which is at GV11 on the back, may indicate toxic heat in the heart. So it's around T5. Pulse palpation.
Mahapdi yan, Dok.
Opo.
Mahapdi po yan, Dok.
Nakaka-relate po kayo?
Yes po, Dok. May mga nakikita po ako mga pasyenteng ganyan. Tapos nung unang sabi nila, hindi gumagaling. Sabi niya kahit daw ginagamot na ng doktor, hindi gumagaling.
So dapat tumitingin sa heart. Dapat siya dinidetox. Meron kasing toxic heat sa heart. So baka naapektuhan talaga yung heart. That's it. Now, punta naman tayo sa pulse palpation ng mga areas related sa Shaoyin heart channel. So try palpating the pulse in the area around heart 6 and heart 7. If you can do it now, mas maganda. For excess and deficiency, it is easiest to feel a strong pulse in this area when excess affects the heart. Tenderness and some puffiness in the area around heart 3. This can show a dermatological condition involving heat in the heart. But significant change in this area is rare. Tightness or thickening of the fascia in the forearm, or if you find nodules along the heart channel, a few inches proximal to heart 4, this may be linked to memory problems or chronic mental fogginess. So this could be the reason why some of us can hardly remember some important data. So if there is thickening in this area, so heart 4, you have to refer the patient to a cardiologist. Most likely, meron po siyang angina or valvular problems associated with rheumatic heart disease. So this is very in the West, but it can be very common in the East, in Asia. Some types of skin disease may also correspond to changes in the heart 4 area. The area
Dok, ibig sabihin, Dok, pag may blockage yun ang isang parang solusyon natin dun sa memory na, ba't ang tagal ko makaalala, pag may block po yun, hindi siya magpo-flow. Yun nakaka-apekto sa memory natin.
Yes. Hindi kasi siya, may connection po kasi yung heart natin sa brain and the eyes. So heart channel, no? Through the heart channel. So very important din po yung area between heart 4 and heart 7. So if you can feel that the skin is thin or rough, na may mga very small grainy nodules, so again, we have to refer to a cardiologist. Baka meron po siyang conductivity problems in the heart leading to irregular heartbeat. Kaya napaka-importante that we should study the pulse and to be able to really determine the regularity of the rhythm.
Sa palpation na Dok, nakakapay yung mga nodules dyan sa channel.
Yes. And you can also feel nodules in the case of heart type insomnia. So nodules from heart 4 to heart 7 or heart-yin blood deficiency type memory problems, especially sa elderly. So one may therefore think of this area as generally reflecting the condition of microcirculation in the brain. So I think this is the reason why nagkakaroon ng dementia, no? Ang iba, or Alzheimer's. It may also be very tender where there are dermatological problems involving heat in the heart. So I guess the cardiologist should be grateful for tying up with us kasi marunong tayo mag-refer. Now, punta naman tayo sa heart 8. So palpate your heart 8, everyone. If you feel na parang tender siya or may mga soft nodules siya, maliliit, there is excess heat in the heart channel. Kaya we always use this point every time you have palpitations or namumula yung mukha. And If there are changes at heartache, this is seen in sleep-related pathodynamics. So if there are changes there, the patient might wake easily throughout the night. Hindi maganda yung tulog. There may also be changes palpated around heartache in conditions involving the tongue when the heart channel or organ is involved. Okay, so let's try to summarize. So let's start with the heart 3. Pag meron po tayong nakitang swelling or slightly raised slightly raised na bukol dyan, so we may think of heart type dermatological conditions. So if there are tenderness naman sa heart 3, excess type condition affecting the heart. No? Now for heart, okay, let's go now to heart 4 to heart 7. Okay. So if you feel some thin or rough skin sensation here, meron pong heart blood deficiency. So now you would understand bakit ang hirap matulog ng pasyente, no? Pero nakakatulog naman siya, pero yun nga lang, matagal makatulog. That's heart blood deficiency. So try to feel for some rough sensation along this area from heart 4 to heart 7. Now, if you feel some tightness or thickness, there is excess type heart problems. And this may involve dermatology. So baka may skin usually kasi pag mapupula, skin issues po yan. Dermatologic issues. Now, kung may nodules naman, heart 4 to heart 7, the microcirculation in the brain is affected, or baka tumatanda na tayo and we have memory problems. Okay? Then tenderness, heart 4 to heart 7, there is heat from deficiency, insomnia. So when you have heat from deficiency, insomnia, ito yung mga taong they have nights, they keep waking up throughout the night. No, kasi mainit yung pakiramdam. Then memory problems also. Now, pag
Tapos yung lagi nananaginip daw ka, no?
Oo, hindi. Putol-putol yung tulog. Then dream disturbed sleep. Yan. Kaya nagigising. Then grainy naman, pag grainy sensation there's conductivity problems in the heart. So, i-check natin, baka irregular yung heartbeat. Now we go to heart 6 to heart 7. If there is a strong pulse here, excess po yan, affecting the heart. Pag grainy naman, there is stasis type of insomnia. Now for heart 8, pag may tenderness, there is some heat affecting the heart or the tongue. Pag may nodule sa heart 8, there is more chronic heart heat. Okay? So thank you very much for your attention. We now proceed to the last topic. We are still on breathlessness, still on identification of patterns and treatment. Case history. We have a 75-year-old woman suffering from breathlessness for 40 years. The breathlessness started after double pneumonia and collapse of a lung. She was treated with prednisolone for many years. She found it difficult to breathe in or out. Meron siyang sensation of oppression of the chest and slight nausea. Lips slightly cyanotic. Expectorated white watery sputum. Easily felt cold. Back and knees ached. Occasionally, meron siyang palpitations. Tongue was very pale but also bluish on the sides, the chest area. Very swollen. Her pulse was deep, weak, and slow. It was particularly weak on both rear positions. This condition is due to extreme deficiency of yang of the lungs, heart, spleen, and kidneys, leading to phlegm fluids in the lungs and heart. Punta mo tayo sa prognosis and prevention. Both acupuncture and herbal medicine are effective in treating breathlessness. The kind of results obtained depends on the duration of the disease and the condition of the patient. Acute patterns, very quick in response, while chronic conditions obviously will respond slowly. For example, the first three patterns, yung mga wind cold invading the lungs, wind cold on the exterior, phlegm fluids in the interior, and cold on the exterior, heat in the interior, are acute conditions. And they should respond to treatment in a few sessions, combination of acupuncture and herbs. The other excess patterns of phlegm heat in the lungs, turbid phlegm in the lungs, lung qi obstructed, and liver fire invading the lungs will take longer to treat, between a few weeks and a few months, depending on the severity of the condition. The one of these four patterns that is most difficult to treat is that of turbid phlegm in the lungs. So deficiency patterns, the most difficult to treat is lung, heart, and kidney yang deficiency. Very chronic po ito. Occurs only in old people, and there is phlegm fluids affecting heart and lungs. Phlegm fluids are the type of phlegm that is always very difficult to treat. Herbs are necessary whenever there is phlegm, and they are better than acupuncture at resolving the phlegm. Acupuncture on its own gives particularly good results in the two liver-related patterns, lung qi obstructed and liver fire insulting the lungs. After a successful treatment, you have to take certain preventive measures para hindi na po bumalik ang breathlessness. Diet. Abstain from eating dairy foods, milk, cheese, butter, cream, yogurt. So say goodbye to ice cream because these tend to form phlegm, which easily settles in the lungs and obstructs breathing. Greasy and fried foods should be kept to a minimum. Advise the patient not to eat too much fresh fruit and raw vegetables. Not too much. Pwede pa rin kumain. Although in moderation, beneficial po itong gasing pagkain, in excess, they tend to form phlegm and injure the young. So this is important for those patients whose breathlessness was caused by yang deficiency. So kung meron na pong yang deficiency, bawas-bawasan na po yung mga raw food. Life habits. They should take great care in protecting themselves adequately from wind and cold. The dictates of fashion now, merong ibang halos nakahubad na, are not conducive to sensible dressing. Patients who have been suffering from breathlessness should take care to protect the upper back and chest. Preventive treatment. Both moxa and herbs can be used to prevent recurrence of breathlessness. So indirect moxibustion with garlic can be applied in the summertime at 10-day intervals on the following three groups of points. Yung nga mag-aamoy, garlic. Okay, first group, extra point, Bailao, which is located on the occiput, one soon below the hairline and one soon from the midline. Bladder 13 and bladder 43. The second group, 214, bladder 12, bladder 20. Third group, bladder 11, bladder 13, and bladder 23. So mag-aamoy garlic po tayo. Yun lang. No? So maraming salamat po, everyone. Thank you for joining. Hope to see you in our next presentation. Good afternoon, everyone.